the heart consists of four chambers: the right and the left atria, which receives blood, and the right and left ventricles, which pump it out. The right atrium receives the systemic venous return, and the inferior vena cava and superior vena. No, so sorry. The right atrium receives the systemic venous return from the inferior vena cava and superior vena cava. This blood is deoxygenated and it travels through the body. The right atria collects this blood and directs it to the right ventricle through the tricuspid valve. The right ventricle is the pumping chamber of the right side of the heart. It pumps the deoxygenated blood through the pulmonic valve into the pulmonary artery. From there, the two main branches of the PA deliver the pulmonary cardiac output to the lungs for oxygenation. The left atrium collects the pulmonary venous return from the main pulmonary veins. Remember, these veins contain oxygenated blood, while systemic veins contain deoxygenated blood. The left atrium directs this blood through the mitral valve into the left ventricle. The left ventricle is the pumping chamber of the left side of the heart, generating roughly 5 times the pressure of the right ventricle. It pumps out the deoxygenated blood through the aortic valve into the aorta and throughout the body. There are four valves. The 4 cardiac valves are vital to the movement of blood in the heart. By opening and closing at specific moments within the cardiac cycle, they prevent backflow of blood. Normal heart sounds are caused by changes in blood flow as the valve closes. The first sound, S1, occurs when the mitral and tricuspid valve close. The second heart sound happens when the closing of the aortic and pulmonic valves. Adjust the speed with the slider. Areas of auscultation. While listening to auscultation heart sound, it is standard practice to use a stethoscope. This section will introduce the areas on the pericardium to place the stethoscopes during a cardiac auscultation exam. When auscultation for the aortic valve, place your stethoscopes on the second right intercostal space in the upper right sternal border. Click the aortic area to listen, then click next when you are ready to proceed. When auscultating for the pulmonic area, place your stethoscope on the second left intercostal space at the upper left sternal border. This is the pulmonic area. For Erb's point, place your stethoscope on the third intercostal space at the medial left sternal border. It can be heard in the left lateral recumbent position. Click on Erb's point to listen. When auscultating for tricuspid valve, place your stethoscope on the fourth intercostal space at the left sternal border. Click on the tricuspid area to listen. When auscultating for mitral area, sometimes called the apical area, place your stethoscope at the apex of the heart on the fifth intercostal space at the midclavicular line. pericardium assessment sound. This section will review some common types of abnormal heart sounds and compare them to normal heart sounds. Ventricular gallop. A ventricular gallop is the third harsh sound, S3. This low frequency vibration occurs after S1 and S2 and seems to result from the change in blood flow in diastole when rapid filling ends and slow filling starts. When listening for S3, the harsh sounds resemble the pronunciation of the word Kentucky, with the Y representing S3. S3 has been described as testing the auscultatory skills of the examiner because of its low frequency and intensity, as well as interference of the normal sounds in the chest from the lungs and abdomen. It is best heard with the bell of the stethoscope. Sometimes it is normally heard in those under the age of 40 and trained athletes. The heart displayed on the right exhibits ventricular gallop or S3. Click on the difference. I think that's the one right there, the fourth one. So the last two are abnormal. Yeah, just the last two are abnormal. Yeah, so that's called ventricular gallop. Atrial gallop, S4, and atrial gallop is the fourth heart sound. S4, it is a low frequency sound that occurs in late diastolic filling due to atrial contraction. This causes vibration in the ventricular walls and happens just before S1, making it difficult to hear. If loud, it can indicate pathology, and it resembles the pronunciation of the word tenness, where the 10 is S4, and when it is clearly heard, it indicates an increased resistance to ventricular filling. Sometimes S4 can occur normally in people older than 40, especially after exercise. I think that's it right there. So let's start it all over. So this is the aortic valve. That's the aortic valve, and that's normal. This will be the pulmonic valve, normal pulmonic valve, and that's also a normal pulmonic valve. Let's check the Erb's point. Erb point is also normal. Let's check the tricuspid valve. Okay, tricuspid valve has some as well. Let's check the mitral valve, the apical pulse. hear it both in the tricuspid and atrial valve. Tachycardia, rapid resting heart rate. Considered an arrhythmia and or disorder of the normal cardiac rhythm. Tachycardia is a resting heart rate of over 100 beats per minute. There are a number of factors that can cause tachycardia. Some of these factors are not particularly serious and have no associated heart complications, such as tachycardia from stress due to illness. However, more serious issues can arise if tachycardia is chronic and left untreated. Heart function can be disrupted and serious complications can arise. So basically, you can hear tachycardia at all 5 landmarks. Tachycardia is kind of hard to hear in the mitral valve area, but it's still fast. It's a fast heart rate. Bradycardia, slowing rest heart rate. Also an arrhythmia. Bradycardia is a resting heart rate of less than 60 beats per minute. In many situations, bradycardia does not cause any symptoms or complications. However, it can be a sign of dysfunction of the heart's electrical system. Bradycardia can be heard at all 5 landmarks. And it's basically just a slow heart rate. Pericardial friction rub. Pericardial friction rub is a sound generated from the inflammation of the pericardial sac as it rubs against the lining surrounding the heart, and not really a harsh sound. Pericarditis is an inflammatory disease of the pericardium which causes the membrane to become sticky, producing friction when the heart beats or when the patient breathes. This friction produces a sound known as pericardial friction rub. It is a scratching, grating, high-frequency sound that is heard in both systole and diastole. It seems to be best heard with the diaphragm of the stethoscope at the left lower sternal border. It seems to be best heard with the diaphragm of the stethoscopes at the left low sternal border. That's definitely abnormal. 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 You could hear it at all of the landmarks. This is what you call a pericardial friction rub. Murmurs. Abnormal heart sound can also include murmurs, which are produced by turbulent blood flow. Murmurs are normally heard during auscultation, and it takes practice to identify them. Innocent murmurs are non-cardiac murmurs related to pregnancy, hyperthyroidism, exercise, and anemia. Is most often heard in children. This type of murmur is normally heard with systole in the pulmonic pericardial area. Pathological murmurs are due to congenital or valvular defects. Specific valvular defects can be identified by their timing during systolic and diastolic and the auscultation region where they are heard. You can definitely hear that whoosh sound on this side of the landmark. Definitely another whoosh sound. I can't hear the whoosh sound in the last 3 landmarks, but the first 2 landmarks I can hear the whoosh. And it says right here, it is correlated to the S in timing and is best heard in the pulmonic and aortic regions. Identification activity. Identify the findings in the heart on the right by comparing it to the normal on the left. Remember, an abnormal Abnormality in the heart can often be heard from multiple regions. After auscultation, all 5 regions choose the correct answer, finding from the drop-down menu. So it's not an S3. I thought it was an S3. So I'm going to try atrial gallop. So it's atrial gallop. So I guess I'm done with this lab.
The abdominal exam is an interview and physical assessment that aims to pick up on any gastrointestinal or urinary pathology that may be causing symptoms such as abdominal pain, distension, or altered bowel habits. In Ms. Jones' case, you will be performing this assessment to check in on her fluid balance and her overall GI health after spending her first 24 hours in the hospital. You should also still cover a targeted review of systems and her family history related to this system while you're doing your assessment. Because we are tasked with determining Ms. Jones' fluid status, we want to start out with a couple questions about that topic. What is your urine like?
Light yellow or almost clear. The regular color.
How often do you urinate?
I don't know. Every hour or two when I'm awake.
Do you wake up at night to urinate?
Yeah, I definitely get up more than once during the night.
All right, so there is definitely a lot to follow up on there, so you can finish determining her fluid balance and then continue on and talk about her overall abdominal health. I also want you to remember to ask about history of diseases of the abdomen. Think liver, bowel, and bladder. This is often missed by students. Then you're going to move on to your targeted abdominal physical assessment. You will have the opportunity to practice percussion on the abdomen. You will have to listen to the sound, identify it, and then document what you're hearing. Doing the abdominal concept lab prior to this will help you practice and get the most out of your experience.
Hi, I'm Preceptor Diana. I'll explain the details of this assignment and your objectives, just as a preceptor would in real life. Pay close attention to this information, as it will help guide your exam. At the end of this pre-brief, you'll answer a short question about the upcoming assignment. During the simulation, you may return to these instructions at any time by scrolling to the top of your transcript. It's 8 p.m. on Tina Jones's first day as a patient here at Shadow General Hospital. Your role in this simulation is that of a healthcare provider who will perform a full abdominal exam on Ms. Jones. She's spent the whole day in bed, so you will want to determine whether she has full abdominal function and if bed rest has impacted her gastrointestinal health.
She has spent the whole day in bed rest, so you'll want to determine whether she has full abdominal function and if bed rest has impacted her gastrointestinal health.
In your interview with Ms. Jones, you will ask about her inputs and outputs, I's and O's, and the overall health of her abdominal system so that you can identify any issues and document findings accurately. If you discover any disease states, ask about symptoms and the patient's experiences of them. Your questioning should cover a broad array of the symptoms' characteristics. You will also inquire into the health history of Ms. Jones' family with regards to the abdominal system so you can determine her genetic predisposition to any diseases. Regardless of whether you have assessed Tina previously, ask all questions that are medically relevant to her abdominal system. In addition to collecting subjective data, you will perform a physical exam on Ms. Jones' abdominal system to gather objective data about the system's health and physiology. While you should communicate with patients using accessible everyday language, it is standard practice to use professional medical terminology everywhere else, such as in documenting physical findings and nursing notes. You may complete the exam activities in any order and move between them as needed. You will complete nursing tasks to protect the patient's safety, privacy, and health. You can document your findings, including vital signs, in the electronic health record. This record provides necessary information for healthcare professionals who will continue patient care. Activities other than subjective and objective data collection, such as documentation and education and empathy, provide valuable practice for their real-world counterparts. However, they are not automatically graded by the simulation. In this assignment, you will be evaluated on your subjective and objective data collection. The evaluation of your interview is dependent on how you word your questions therapeutically and precisely, and explore all relevant topics with comprehensive breadth and depth. The evaluation of your physical exam is based on how successfully you report on your physical findings by selecting among clinical terms in the electronic health record. This assignment takes on average between 35 and 50 minutes. You can pause and resume the assignment at any time. Your work is always saved automatically. In this assessment, you will become familiarized with the structure and content of abdominal exams so that with real-life patients you can ask effective and comprehensive questions, use therapeutic language, evaluate the patient's risk of disease, infection, injury, and complications, and obtain and assess objective data. In this assessment, you will become familiar. In one or two sentences, answer this question to help prepare for the upcoming exam. What effects can bed rest have on the abdominal system?
Bed rest can cause a decrease in peristalsis, which can increase constipation.
Time to begin. This tutorial will guide you through the 4 pre-exam privacy and safety checks that must be completed every time you enter your patient's room. If you would like to skip this tutorial, click the Close button.
Hello, my name is Nate. I'm going to be your student nurse today.
Thanks for telling me.
You're welcome. Give me 1 second while I grab your vitals. Thank you.
Thanks for telling me.
On a scale of 1 to 10, what is your pain level right now?
It's like a 6, maybe more like a 7. It's better than before, that's for sure.
What is your weight right now?
I don't remember what it was. Under 200, I think.
Vitals are 36.7 Celsius for temperature, 134/88 for blood pressure, heart rate 68, respiratory rate 16, O2 saturation 98, pain scale 6 to 7. Now let me go to backflow. What brought you to the hospital?
I got this scrape on my foot a while ago, and I thought it would heal up on its own, but now it's looking pretty nasty, and the pain is killing me.
Do you have any pain in your stomach region?
No, my stomach has felt fine.
Do you have any constipation or diarrhea?
No, neither.
Are you experiencing any nausea or gasiness?
No, I haven't felt nauseous.
Are you vomiting?
No, I don't feel sick at all.
Do you have any heartburn symptoms?
No.
Describe your bowel movements.
It's normal, I think.
Do you have any gasiness?
No.
Do you have any food intolerance?
I can eat just about anything.
Has your appetite changed?
I've definitely been eating a lot more lately.
Do you have any problems urinating?
No, I can pee fine.
What does your urine look like?
Light yellow or almost clear. The regular color.
What is your fluid intake?
I haven't really been keeping track, but I drank a lot of water lately. I've been thirstier than usual. Oh, and sometimes I'll drink Diet Coke, too.
Do you have diabetes?
Yeah, I was diagnosed a few years ago.
How often do you check your blood sugar?
When I'm at home, I don't check it much, honestly. But it's been getting checked since I've been here.
High blood sugar can cause an increase in thirst.
Thanks for telling me.
Describe your typical meals.
Oh, we try to make something easy. We eat a lot of frozen chicken breasts. We do hamburgers that we make at home every so often. We make sure we have a vegetable, and we eat a lot of potatoes. And we usually have rolls or something.
What is the frequency and duration of your urination?
No, I'm not taking anything for my stomach. It's fine.
How, how frequently do you urinate?
I don't know. Every hour or two when I'm awake?
Do you smoke or drink alcohol?
No, I've never smoked a cigarette in my life.
How much alcohol do you drink?
Not very much.
Do you take any illicit drugs?
Yeah, in high school and a little after that, I smoked pot sometimes. But I haven't done anything like that in a long time.
How much alcohol do you drink weekly?
At most, I drink 1 or 2 days on the weekend. But it's not like I'm drinking every week.
Do you have any stomach issues?
No, my stomach feels fine.
Have you experienced any weight changes? Has your weight gone up or down?
I've actually lost some weight recently.
Are you type 1 or type 2 diabetic?
It's type 2.
Have you had any issues with the liver, bowel, or bladder?
No, I've never had any problems with my liver.
Has your family had any gastrointestinal issues?
Not that I know of.
Does your family have a history of colon cancer? Does your family have a history of colon cancer?
Grandpa Jones died of colon cancer.
My condolences. I'm sorry.
Thanks.
What age did your grandpa die from colon cancer?
Let me think. He died when I was really little. I think he was in his mid-60s. He died of colon cancer.
So for abdominal, I'm doing my objective data now. So I'm inspecting the abdominal. It's symmetric. I would say it's round for contour, appearance, no visible abnormal findings. It's hard to look for rashes and all this other stuff over down here. Okay, and now let me go back and do the auscultation of the bell sounds. Don't hear anything. Okay, there's some right there. So the last two I heard sounds. Let me go back to the first two again. Nothing. Okay, there's one over there. So I'm gonna go in normal active, all four quadrants. So I auscultate the bell sounds. And I'm gonna do the abdominal aorta. Just one landmark. Don't hear nothing, no boot sound. Go back and do the abdominal arteries. So there are 6 for the abdominal arteries. So let me listen to them. Nothing. So no brute on all of that. No brute. No brute. So right renal, right iliac, right femoral, left renal, left iliac, left femoral, left glute. Abdomen. So percussion of the abdomen. So let me do a quick research on what a normal percussion for abdomen is. Tympanic. In addition to detection of ascites, so percussion can be used to help define the nature of abdominal masses. So that's what we're assessing for abdominal masses. Tympany of an abdominal mass implies that it is gas-filled. Percussion is also used to define liver size. So the normal abdominal percussion sounds. The predominant sounds of percussion in the abdomen are tympany and dullness. Tympany is elicited over air-filled structures and dullness over fluid or solid organs. So if it's dull, that means it's fluid or organ. That means it's fluid or solid. Tympany is elicited over tympany is heard over air-filled structures. So some areas are dull. Let me check to see. Resonate. The stomach bubble should produce a very tympanic sound upon percussion over the left lower cage close to the sternum. Percussion can be quite helpful in determining the cause of abdominal distension, particularly in distinguishing between fluid and gas. So we're trying to distinguish between fluid and gas in the abdominal region. So I'm going to go with all areas are tympanic. Trying to find out what is a normal percussion sound. I'm just trying to be sure. So there are 4 types of percussion sound: resonant, hyper resonant, tony, dull, or dull. A dull indicates the presence of a solid mass under the surface. A more resonant sound indicates hollow air containing structures. I'm going to go with tympanic. Oh man, this is a little more annoying than I thought. Should percuss abdomen resonate. I'm gonna go with all areas, some area dull. Let me listen to this again. So I think I found something that's a little helpful. Percuss the 4 quadrants of the abdomen to determine the amount of tympany and dullness. Normally you hear tympany because of the air in the underlying structure. Percussion occurs over the liver and spleen, which produces a dull sound. Dullness may indicate an enlarged uterus, distended urinary bladder, or ascites. So I think it's going to be a mixture, and some area dull, some areas tympanic. Let me go back. CVA tenderness. Does this hurt? Liver span. The percussion sequence will be performed automatically. Be sure to listen for changes from tympany to dullness. So it says right here, percuss for liver span 7 centimeters in the midclavicular line. So I'm going to put 6 to 12. Palpate. So palpate the abdomen. So palpate right lower quadrant with light pressure, no tenderness reported, no masses. No quadrant tender. Other observation, no additional observation. So deep. So now we're doing deep palpitation. So no palpable mass. So I believe we're just checking for mass now. That's what deep palpation is for. Now it's liver, which is upper right. So palpable liver, palpable 1 centimeter below right costal margin. Not palpable. So it's palpable. So it's palpable 1 centimeter below right margin. Liver palpable versus not palpable. Cases in which normal level is palpables include emphysema, right-sided pleural effusion, thin body structure. If the liver edge is not palpable on adequate exam, no further examination patient. So it's supposed to be not palpable. She doesn't have any liver issues. Palpate liver 1 centimeter. An enlarged liver is one that's bigger than normal. The medical term is hepatomegaly. Rather than a disease, an enlarged liver is a sign of underlying problems such as liver disease, congestive heart failure, or cancer. Treatment involves identifying and controlling the cause of the condition. So it's palpable 1 centimeter below costal margin. So hers is palpable. It's 1 centimeter, and that's not a good thing. So palpable 1 centimeter right costal margin, which is not a good thing. So check for spleen. Spleen is not palpable. Check for kidneys. Kidneys not palpable. Both right and left are not palpable. So not palpable is a good thing. So that means it's not enlarged. So back, exam menu. So nursing note. Chief complaint, scrape on right foot. But states she has normal bowel movement. Appetite has increased lately. Urine is yellow to clear. Thirst has increased on monitor. Type 2 diabetes. Diet is normal. Has had weight loss recently. States no for liver, bowel, bladder problems. So let me end the exam over here. So that's finalizing your assignment. .34 out of 36, which is a 95.4%. Total minutes is 42 minutes. I'm proficient. So I got all my subjective data, but I need to work more on my objective data. Okay, let me go back to return assignments. So last time I had 85, now I have a 95. So total for this is an hour. Return to course. So now I'm about to do neurological. Let me take a break. It's not good to keep going.
The neurologic exam is an interview and physical assessment that focuses on the nervous system, which includes the brain and spinal cord, as well as the peripheral nerves. Because Ms. Jones has a history of falls as well as diabetes, you will conduct a complete neurologic exam in order to collect subjective and objective data to assess her risk for neuropathy. You should also still cover a targeted review of systems and her family history related to this system. Now, as I said, we know Ms. Jones has a history of diabetes that is not well controlled and is therefore at risk for neuropathy. So you would want to open up asking about those things as they are at the top of our list for this assessment. Do you have any numbness in your arms or legs?
No, I don't think so.
Do you have any tingling in your arms or legs?
Nothing like that I've noticed.
Can you feel warm and cold normally? You would also want to ask about vision problems. You want to look for blurred vision or double vision as a red flag to investigate a little bit further. Do you have any vision problems?
Yeah, actually, I have been noticing my eyes getting kind of blurry lately.
All right, you're going to have to circle back and follow up on this one. Don't forget to ask about migraines, seizures, concussions, and meningitis in order to complete a thorough neurologic history. And prior to beginning, it would help to review how to perform a mental study. All right, you're going to have to circle back and follow up on this one. Don't forget to ask about migraines, seizures, concussions, and meningitis in order to complete a thorough neurologic history. And prior to beginning, it would help to review how to perform a mental status exam as you will be performing one on Ms. Jones. A thorough neurologic history. Don't forget to ask about migraines, seizures, concussions, and meningitis in order to complete a thorough neurologic history. And prior to beginning, it would help to review how to perform a mental status exam as you will be performing one on Ms. Jones. I'm going to stop here and go ahead and let you get started.
Hi, I'm Preceptor Diana. I'll explain the details of this assignment and your objectives, just as a preceptor would in real life. Pay close attention to this information, as it will help guide your exam. At the end of this pre-brief, you'll answer a short question about the upcoming assignment. During the simulation, you may return to these instructions at any time by scrolling to the top of your transcript. In your interview with Ms. Jones, you will ask about her neurological system and identify any risk factors so that you can determine any current and potential issues. If you discover any disease states, ask about symptoms and the patient's experiences of them. Your questioning should cover a broad array of the symptoms' characteristics. You will also inquire into the health history of Ms. Jones' family with regards to the neurological system, so you can determine her genetic predisposition to any diseases. Regardless of whether you have assessed Tina previously, ask all questions that are medically relevant to her neurological system. In addition to collecting subjective data, you will perform a physical exam on Ms. Jones' neurological system to gather objective data about the system's health and physiology. While you should communicate with patients using accessible, everyday language, it is standard practice to use professional medical terminology everywhere else, such as in documenting physical findings and nursing notes. You may complete the exam activities in any order and move between them as needed. You will complete nursing tasks to protect the patient's safety, privacy, and health. You can document your findings, including vital signs, in the electronic health record. This record provides necessary information for healthcare professionals who will continue patient care. Activities other than subjective and objective data collection, such as documentation and education and empathy, provide valuable practice for their real-world counterparts. However, they are not automatically graded by the simulation. In this assignment, you will be evaluated on your subjective and objective data collection. The evaluation of your interview is dependent on how you word your questions therapeutically and precisely, and explore all relevant topics with comprehensive breadth and depth. The evaluation of your physical exam is based on how successfully you report on your physical findings by selecting among clinical terms in the electronic health record. This assignment takes on average between 50 and 60 minutes. You can pause and resume the assignment at any time. Your work is always saved automatically. In this assessment, you will become familiarized with the structure and content of neurological exams so that with real-life patients you can ask effective and comprehensive questions, use therapeutic language, evaluate the patient's risk of disease, infection, injury, and complications, and obtain and assess objective data. It's noon on Tina Jones' second day as a patient here at Shadow General Hospital. Your role in this simulation is that of a healthcare provider who will perform a neurological exam on Ms. Jones. You will collect subjective and objective data about her risk for neuropathy, which is higher given her history of falls and diabetes. In 1 or 2 sentences, answer this question to help prepare for the upcoming exam. What physical exam findings would indicate the presence of neuropathy?
In peripheral neuropathy, skin dryness, callousness, bruises, and skin color changes can indicate presence of neuropathy.
Time to begin. This tutorial will guide.
So I don't need to do the whole nursing task, which is basically privacy, infection control, and safety. Those are pretty easy, so I'm just going to leave out of that and go straight to vitals. Oh wait, let me talk to the patient first. Hi, my name is Nate. I'm going to be your student nurse for today.
Hey.
How are you feeling?
I'm feeling a lot better. Thanks.
Are you in any pain?
Yeah, my foot's still sore. It feels a lot better than it did, though.
I'm going to start asking you some questions about your health, okay?
Okay. What about?
Are you able to manage your diabetes?
I just watch what I eat and try to stay away from sweets.
Have you experienced any numbness, tingling, or vision problems?
I haven't noticed feeling numb or tingling anywhere.
Do you experience headaches?
Yeah, my head aches sometimes, but it's okay right now.
What triggers the headaches?
The longer I read or study, the worse my headaches get. I try to take a break and rest when they start, but sometimes I'll have a test or something coming up, and then I'll just have to work through it.
Describe the pattern of headaches.
I guess I don't know what you mean.
Does the headache cause constant pain or pain that's intermediate?
It's like a tight, throbbing ache behind my eyes.
Are you experiencing any vision problems?
Yeah, actually, I have been noticing my eyes getting kind of blurry lately.
How are you treating your headaches? Are you experiencing any dizziness?
No, I'm not dizzy.
Do you have issues swallowing?
I swallow fine.
Do you have problem with speech?
No. I might stumble over my words sometimes, but nothing like that.
Have you had issues with fainting or memory loss?
No, I think I have a pretty good memory. I'm not like one of those geniuses who can list all the presidents and their birthdays, but I can remember names and directions pretty well. That kind of thing.
Have you fainted before? Have you fainted before?
I've never fainted, no.
Have you had any muscle issues?
Maybe I need to stretch a little when I get out of bed, but nothing big.
Do you have issues with muscle function?
I think my muscles are fine.
Have you noticed any behavioral changes?
My behavior's been normal, I think.
Do you do any illicit drugs?
No.
Do you smoke tobacco?
No, I think it's gross.
Do you drink alcohol?
I do sometimes, yeah, when I go out with my friends.
Have you had any history of neurological problems? Does your family have a history of migraines?
No one in the family gets migraines that I know of.
What is your name?
My name's Tina Jones, and my birthday is February 17th.
Can you tell me where you are? What building are you in?
This is Shadow General Hospital.
Can you tell me the time and date?
Today's date is
How are apples and oranges alike?
How are they alike? Um, they're both kinds of.
How are a lake and a ocean alike?
Uh, they're both bodies of water.
How are a trumpet and a flute alike?
They. They're both musical instruments.
To test a person's attention, you will assign a simple math activity that can be completed in less than a minute. During the task, keep track of the number of errors and how long the patient takes. Patients who have difficulty with the test could suffer from a loss of calculating ability, dementia, intellectual disability, anxiety, or depression. To do this test, Tina asked her to count backwards by 7 from 100. Count backwards by 7s from 100.
Okay, 100, 93, 86, 79, 72, 65, 58, 51, 44, 37, 30, 23, 16, 9.
Instructions, okay, for comprehension, evaluate comprehension. Comprehension test assesses a patient's ability to read and follow simple instructions with 1 or 2 steps. More specifically, with these steps, you can identify if your patient can read the instruction, understand their meaning, and properly execute the instruction. Patients who have difficulty with the test may have aphasia. To test Tina's comprehension, you will show her a sheet of paper with a 1-step instruction that we know Tina can perform. Pay attention to the difficulties Tina has with reading or comprehending the instruction. To get started, ask Tina to read and follow these instructions. Read and follow these instructions.
Okay.
Asks you show Tina a 2-step instruction that we know she's capable of performing. Take note if she had difficulty understanding the task. Read and follow these instructions.
Sure.
Assesses a patient's general knowledge, can give a rough estimate of intelligence. For this simple mental test, you can ask questions about basic facts. Most adults will be able to answer them. Remember that a patient with limited education or who do not grow up in the United States may have difficulty. Ask simple questions with increase in complexity. To start with Tina, who was the first president of the United States? Who was the first president of the United States?
That's George Washington.
Who are the last 4 presidents of the United States?
Well,
Name 5 large cities in the United States.
let's see, New York City, Chicago, Detroit, Los Angeles, and Houston. That's 5.
Next, you will get a sense of Tina's judgment skills. Poor judgment may be a sign of delirium, dementia, intellectual disability, or psychotic states. You can assess judgment by asking a question about a hypothetical scenario and assessing how the patient describes her decision-making process. Impaired judgment may involve impulsive thinking, wishful fulfillment or chaotic or illogical thinking. Intact judgment means that the patient seems generally mature and describes reality-based decision making. Ask Tina, what would you do if you found a stamped and addressed envelope on the sidewalk? What would you do if you found a stamped and addressed envelope on the sidewalk?
What would I do? Well, I try to figure out who dropped the envelope, but if not, well, I'd probably just drop it in the first mailbox I saw, if there was one nearby.
Now you will test Tina's memory. First, you will ask her how to remember. You will ask her to remember 4 unrelated words. Then you will ask her a question about a past event to assess her remote memory. After that, you will ask her to repeat the 4 words from before. This will test Tina's ability to learn new information. Difficulty recalling the 4 words could indicate an underlying disorder. For example, anxiety can decrease one's ability to concentrate, and depression can cause a lack of motivation to remember. Ask Tina, repeat and remember burger, turtlip, nose, and tea. Memory. Repeat and remember burger, turtlip, nose, and tea. Repeat and remember burger, tulip, nose, and tea. Repeat and remember burger, tulip, nose, and tea.
Burger, tulip, nose, and tea.
How did you celebrate your last birthday?
Wow, it's weird. Birthdays were huge for us before Dad died because he would always make a really big deal out of them. Like he loved planning these huge celebrations. But the past 2 birthdays, he hasn't been there. So it's been kind of sad thinking about what he's missing. And we haven't done huge parties or anything. Last birthday, Michael and his fiance came over, and we all had dinner at the house, and I opened presents, and we had a really good cake from this bakery I love. It was nice.
Repeat the 4 words from before.
Burger, tulip, nose, and tea.
Record your overall impression of Tina's vocabulary based on your observation during this mental status to confirm that it's typical for a non-impaired adult. So her observed vocabulary was expected complex for patient's age, education level, and general ability. Her vocabulary is good, in my opinion. Articulation. Now record your overall impression of the patient's ability to articulate based on your observation during this mental status exam. Are you able to hear the patient's words clearly? Do you observe any atypical traits such as slurring or stuttering? If you need to ask the patient an additional question, can you tell me about school?
School's really great. I've been doing really well, and I'm in my last semester, so I'll have my bachelor's in accounting in just a
To test for peripheral neuropathy, use a 10-gram monofilament to touch your feet. A normal patient can feel the, the monofilament in all areas of the feet. To test, ask Tina to close your eyes and tell me when you feel this. Close your eyes and tell me when you feel this. Close your eyes and tell me when you feel the touch.
Okay, yes. Yes. Yes.
A lack of position sense can indicate damage to the brainstem or spinal cord or a nervous system disorder like multiple sclerosis. Ask Tina, close your eyes and tell me if your finger or toes move down. Close your eyes and tell me if your finger or toes move up or down.
Okay. Up. Down. Down. I think that was up.
So we're testing for stereogenesis is a patient's ability to recognize the common objects from tactical cues like texture, size, and shape. As stereogenesis may indicate a condition like Alzheimer's or lesions on the sensory cortex in the parietal lobe or posterior column of the spinal cord. To test Tina's stereogenesis, you would place common objects in her hand and ask her to name them. Close your eyes and tell me what I put in your hand.
Okay. Some kind of coin. This is some wire thing. Paperclip? That feels like a key. Some kind of coin. The paperclip again. That feels like a key.
Sensation for the legs. Close your eyes and tell me if the touch is sharp, dull, or soft. Left leg proximal.
Dull. Dull.
So let's expect. So this is weird. So my question was, close your eyes and tell me if the touch is sharp, dull, or soft. So I just did the left. Expected sensation, decrease proximal. So it's I don't know if that's normal or not. So we are doing tested sensation in legs, sharp, dull, soft. Oh shit. Cancel. That was a close call, man. So she said dull for the left. So let me try for the right.
Dull. Dull.
Dull. Okay. So it's dull for everything. Test the sensation leg. Decrease proximal sensation. Decrease distal sensation. to test the patient's ability to sense mild pain and dull and soft. Then select an option from the sensation tool menu. Close your eyes and tell me if the touch is sharp, dull, or soft. So she said it was dull. I'm not going to go through that again. So is dull sensation and legs good or bad? Dull expected sensation, decreased proximal sensation. Does dull indicate decrease in sensation? What is dull in sensation? It says loss. So Google says, what is a decrease in sensation? Loss of sensation means that you are unable to feel pain, heat, or cold. This can happen in one or more parts of the body. Numbness is a loss of feeling. It's an inability to stand with feet together. Lumbar tests. So I think she has a decrease in proximal sensation. So I'm gonna go with a decrease in distal sensation. Decrease distal sensation. Decrease in distal sensation. Yeah, because I don't think her lack of sensation has went all the way to the proximal yet. And it's definitely not expected. It's all decrease in distal sensation. Close your eyes and tell me if the touch is sharp, dull, or soft.
Dull. 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 Dull.
So close your eyes and tell me if the touch is sharp, dull, or soft. Now, I don't know which one is good, which one is bad, sharp, dull, or soft. Sensation to selection.
Soft.
Okay, I think I get it now.
Soft.
Soft. Okay.
Soft.
So I went to the sensation tool selection and
Soft.
got it.
Soft.
Okay, so so it looks like it's supposed to be expected. It looks like it's on the good side. So now let me go for sharp. I can change if it's dull, sharp, or whatever.
Sharp. 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 Sharp.
So it looks like everything's expected. Expected, expected, expected. Let me go back to the arms. Oh, crap. Close your eyes and tell me if the touch is sharp, dull, or soft. Close your eyes and tell me if the touch is sharp, dull, or soft.
Soft. Soft. Soft. Soft. Soft.
Okay, let me change the sensation. Let me go to sharp.
Sharp. Sharp. Sharp. Sharp.
So everything is looking good. Everything is expected. So I was in the wrong. Expected, expected. Alright, so for the sensation, I should have changed the sensation from dull, sharp, and soft. I figured that out now. Alright. Gastroesthesia is the ability to identify a number or letter that's traced on the skin. If a patient can't identify the number of letters, this can indicate damage to the sensory cortex of the parietal, damage to the spinal, or Alzheimer's. Close your eyes and tell me what I trace on your palm. Left hand A.
That's an A. A figure eight.
Able to identify, great. Deep tendon reflex now. Patellar. Unsteady. Her gait is unsteady. No, her gait is unsteady, right? Tina's gait is unsteady, so we should go to gait. Hesitancy. Hesitancy for gait. Asymmetric steps. Because of her injury, Tina's gait is unsteady. How is your balance when you walk?
It's fine, I think. I'm kind of clumsy, but that's all.
Alright, so she has responses. So active, expected, expected. Brachioradialis. Active, active. So brachioradialis is good. Biceps, check our biceps. Bicep is good. Check the left side. Bicep is good. Let me check our triceps. Let me check our Achilles. Let me go back to the right. So it's good, it's as expected. Tested point to point. So the vitals were done, right? I think I might have missed the vitals. Let me put the vitals in. Enter temperature. Blood pressure 122 over 88. Heart rate is 69. Respiratory rate is 16. O2 saturation is 98. On a scale of 1 to 10, what is your pain level?
It's at about a 6 out of 10.
What is your weight right now? How much do you weigh?
I think I'm around 190.
Vitals are done. Motor skills. Heel to shin. Okay, let me do heel to shin. Next, you will test point to point movement of your patient's leg by asking her to run a foot down the opposite shin. In patient with cerebral disease, the heel may not make a straight path down the shin. If a patient physician senses absence, she may lift her heel too high. Watch to see if Tina's heels make a straight path down the shin and note the smoothness. Run your foot. Run your right foot down your shin. Run your left foot down your right shin.
Oh.
Smooth and accurate, smooth and accurate. So review the objective data and review and complete your documentation to the right. To revise your objective data, click back. You are missing objective data for 5 items. So 5 items are missing. So triceps reflex, finger to nose, and alternating hand movements. Triceps, finger to nose. Right, gotcha. Finger to nose. Close your eyes and touch your fingers to your nose. Smooth and accurate. Rapid hand movement. Place your hand on your knees and turn them over.
Okay. Like
You will perform without any difficulty. So let me go to lower transit, deep tendon, neurological. Where was this? The triceps. Oof, 96.7. Interacted with the patient for 61 minutes. So proficient, so this did well. 21 of 21. Objective data collection 22 out of 24. Return to the assignment. focused cough exam. This could take anywhere from 65 to 100 minutes. God help me.
This type of assessment is a little bit different than the ones you're used to doing with Tina Jones. In this scenario, you will meet Danny Rivera, who is an 8-year-old boy who is sent to the school nurse's office because he has been coughing. You will act as a school nurse to gather data and decide if Danny is in respiratory distress, if he needs to see a doctor, or maybe he just needs to be sent home. At the end of this assessment, you will complete a care plan activity to put into action what you've learned during your assessment. Since Danny is walking into the nurse's office, maybe we want to start with an open-ended question to establish his chief complaint. What brings you in?
My music teacher, Mr. Hillman, sent me here because he said I look sick. I've been coughing a lot, and I feel kind of tired.
Now we want to qualify the cough a little bit and see if we can get some more information from Danny. When did the cough start?
Think the cough started it started 3 days ago.
Can you describe your cough?
My cough seems kind of gurgly and watery.
You'll be able to ask Danny a lot more questions about his cough to get a good idea of what's going on here. Remember also to ask about activity level and medication use. This interview should also include relevant components from the HEENT and respiratory assessments, so remember to ask about things like nasal discharge, sinus pain, red eyes, watery eyes, vision problems, night sweats, and chills. You may also want to revisit the respiratory concept lab before you begin the physical assessment. I'm going to stop here and let you take the reins.
Hi, I'm Preceptor Diana. I'll explain the details of this assignment and your objectives, just as a preceptor would in real life. Pay close attention to this information, as it will help guide your exam. At the end of this pre-brief, you'll answer a short question about the upcoming assignment. During the simulation, you may return to these instructions at any time by scrolling to the top of your transcript. Your patient is Danny Rivera, an 8-year-old Puerto Rican boy presenting with a cough in the Shadowville Elementary Nurse's office. Your role in this simulation is that of a healthcare provider who will perform a focused history and physical examination in order to collect data, assess Danny's condition, and transfer care. In this simulation, you'll be able to perform procedures not always typical to a school setting, so you can gather as much data as possible. Danny is very health literate and a good historian of his own health history. He can answer questions that not every child may be able to. In your interview with Danny, you will ask about the history of his presenting illness and the functioning of relevant systems in order to obtain subjective data related to his cough. If you discover any disease states, ask about symptoms and the patient's experiences of them. Your questioning should cover a broad array of the symptoms' characteristics. You will also inquire into the health history of Danny's family, so you can determine his genetic predisposition to any diseases. In addition to collecting subjective data, you will perform a physical exam on Danny to gather objective data about his health and physiology. Throughout the conversation, you should educate and empathize with Danny when appropriate to increase his health literacy and sense of well-being. While you should communicate with patients using accessible everyday language, it is standard practice to use professional medical terminology everywhere else, such as in documenting physical findings and nursing notes. You may complete the exam activities in any order and move between them as needed. Because Danny is a pediatric patient, you will also be required to make a phone call to his guardian's home to gather additional information. You can document your findings, including vital signs, in the electronic health record. This record provides necessary information for healthcare professionals who will continue patient care. You will then move on to the care plan activity, in which you will synthesize your subjective and objective data to complete the nursing process. You will develop a nursing diagnosis for Mr. Rivera's condition, identify a treatment goal, plan your interventions and evaluations, and finally, assess if your goal was achieved. You may also need to call Danny's guardian again to involve them in his treatments. The care plan is just as important as your assessment, and the patient's well-being will be greatly affected by your diagnosis and interventions. The activities evaluated by the simulation are subjective and objective data collection, education and empathy, and the care plan activity. Nursing tasks and documentation, while they provide valuable practice for their real-world counterparts, are not automatically evaluated by the simulation. The evaluation of your interview is dependent on how you word your questions therapeutically and precisely, and explore all relevant topics with comprehensive breadth and depth. The evaluation of your physical exam is based on how successfully you report on your physical findings by selecting among clinical terms in the electronic health record. Your success in education and empathy is based on whether you promptly respond after identifying a moment worthy of therapeutic communication. Your success in the care plan activity is based on whether you accurately identify Mr. Rivera's nursing diagnosis. Select a goal most immediately beneficial to him. Select and prioritize the most effective treatments, and accurately evaluate your results. The care plan will make up a significant part of your grade, so be sure to carefully choose your answers based on evidence. This assignment takes on average between 80 and 100 minutes. You can pause and resume the assignment at any time. Your work is always saved automatically. In this assessment, you will familiarize yourself with the structure and content of a cough-focused exam, so that with real-life patients you can ask effective and comprehensive questions, obtain and assess objective data, educate and empathize with the patient, develop a nursing diagnosis, create an effective and expedient care plan, and evaluate your results to determine your goal's achievement. In one or two sentences, answer this question to help prepare for the upcoming exam. What strategies can you use to develop rapport with a pediatric patient?
Ask the patient what they're into for fun. Asks the patient what they're into for fun.
Time to begin.
Hi, my name is Nate, and I'll be your student nurse today.
Hi.
Can you tell me your name, please?
My name is Daniel Rivera, but I just go by Danny.
Okay, Danny. Do you know where you are?
I'm in your office, nurse.
Do you have any pain right now?
I don't feel any pain. Oh, well, my throat is a little bit sore.
Sore throat can be uncomfortable. I can understand that.
Thanks.
Do you have difficulty breathing?
I breathe okay, but my nose is always kind of runny.
Do you play any sports?
I don't really play any sports on a team or anything. I like to shoot hoops and ride my skateboard with Tony sometimes. But most of the time we play video games.
Do you get tired very easily?
Yeah, I feel kind of tired. I think it's because I couldn't sleep much at night. My cough kept me from falling asleep.
Does it hurt when you cough?
Nothing really hurts. I just had this cough for about 3 days, and I feel kind of tired.
Does it hurt to talk? Do you cough out mucus?
Is that the gross, slimy stuff? Yeah, I've been coughing some of that up. It's clear.
Have you coughed out blood?
No, I don't cough up blood. Can that actually happen?
How often do you cough?
I think I go to the doctor a couple times a year, unless I get really sick.
Do you wash your hand before you eat?
Sometimes I remember to wash my hands before I eat. When my abuela reminds me, I don't really do it very often though.
Do you take any medication?
Just when I'm sick and my mom or the doctor says I should take some medicine. My mom gave me some cough medicine this morning. Oh, I also have vitamins. I love those. They're yummy and healthy, so I sneak a few more of them.
Are you around a lot of germs?
Well, sometimes Poppy smokes cigars in the house, and my mom has to tell him to go outside. I breathe it a little bit then, but it's not all the time or anything. I don't like how it smells. I don't like that he's hurting himself. He could get sick.
Are you exposed to germs?
I don't think so.
Do you have problems with your ear?
Mom said I had ear infections a lot when I was a baby, but not now. Now they're fine.
Do you have nasal discharge?
My nose is always a little bit runny, but ever since I started coughing, it's been worse, I think.
Are you allergic to anything?
I don't think I have any allergies.
Do any of your family members have a disease?
Mom says Poppy had asthma when he was a little kid. It's not good to smoke cigars now, but he still does. I'm scared he'll get sick.
I understand why you'll be scared of that.
Thank you.
Make sure before you eat, you wash your hands for at least 20 seconds with water and soap, okay?
All right.
Do you have any nasal discharge right now?
My nose is always a little bit runny, but ever since I started coughing, it's been worse, I think.
How often do you have nasal discharge?
You mean like when I blow my nose? It's clear.
Do you have any pain right now?
I don't feel any pain. Oh, well, my throat is a little bit sore.
Are you constantly thirsty?
I don't usually get really thirsty unless it's after gym class or if I'm playing outside.
Do you have asthma?
No, but my mom says Poppy had asthma when he was a little kid. He shouldn't be smoking cigars because of it, but he does. And it makes me upset.
Have you been exposed to any new germs recently?
Well, sometimes Poppy smokes cigars in the house, and my mom has to tell him to go outside. I breathe it a little bit then, but it's not all the time or anything. I don't like how it smells. I don't like that he's hurting himself. He could get sick.
blow into the spirometer. Do you have problem breathing through your nose?
My breathing seems good. My nose is kind of runny right now. But I can still breathe okay.
Is your mouth dry or moist?
No.
Do you have any problems in your neck area?
I don't think so.
Palpating the sinuses. Resuming my inspection, or palpation actually. We're palpating. So frontal, non-reported, maxillary, non-reported. For the sinuses, lymph nodes. So checking the lymph nodes. Checking the lymph nodes. Checking the lymph nodes. Still checking the lymph nodes. Okay, no palpable nodes. Do you feel any pain when I touch you?
No, my head doesn't hurt.
Palpate lymph nodes of the head and trunk. Enlarge and report tenderness on the right side. Okay. Palpable nose on the right side. Palpatus supraclavicular nodes, not palpable. So no palpation on that one. And the axillary. Palpate axillary lymph nodes. Nothing, no palpable nodes. No palpable nodes. Alright, so that's it for lymph nodes. Tactile fremitus.
99.
99. Equal bilateral.
99.
Equal bilateral. Expected fremitus. So do it on the back as well.
99. 99. 99.
So that's the tactile primitus. Chest expansion. So equal and bilateral. So we inspected, we palpated, now we're going to auscultate. Breath sounds.
Vesicular breath sounds are really just a fancy way of saying normal breath sounds. They're what you're going to hear more often than not when you auscultate a patient's lung sounds, and they're usually described as a soft and rustling type noise. Bronchophony is the sound that a spoken voice makes when you listen over large airways. Words are louder and clearer than when listening over peripheral airways. When bronchophony is present in an area that is not over one of the main bronchi, it suggests that there is underlying consolidation, as in pneumonia. You can test for it by having the patient say a few words while you listen with the stethoscope. Say 99 or 123. Marvin, when you feel my stethoscope on your back, I'd like you to repeat the words 99. 99.
Say 99 for me.
$99. $99. $99. $99. $99. $99.
Yeah? Yeah, I'm good. What's up? What happened?
$99. 9, 99,
Heart sounds good. Percuss chest wall. Percuss chest wall. Percussed. Percussed. No area of dullness. Chest wall percussion. Diaphragmatic exclusion. Assess diaphragmatic exclusion by having the patient breathe out and hold his breath. Percuse downward and mark the point where resonance changes due to dullness. Next, have the patient breathe in and hold his breath. Percuse downward again and mark the point where the resonance changes to dullness. Three centimeters. Finally, measure the distance between the points. For Danny, this is 3 centimeter. Normal values fall between 3 and 5. So that's diaphragmatic exclusion. What the hell does that do though? What does diaphragmatic exclusion indicate? Diaphragmatic exclusion is the movement of the thoracic diaphragm during breathing. It tells us how far the diaphragm is moving during breathing, max inhales and exhales. All right. Call a guardian. You call Danny's grandmother. Alright, you call Danny's grandmother at home. Here's the transcript from the conversation. Danny has been coughing for the past 3 days and just hasn't been himself. He was coughing just a little this morning as well, so my daughter gave him some cough medicine before sending him off to school. Do you know any type of cough medicine your daughter gave Danny? It's just sitting here on the table. Actually, it's called Dime Tab, the daytime formula. So the medication he's taking is called Dime Tab. Okay, thank you. Dan told me that it helped his cough this morning, but he's feeling worse again now. He doesn't have a temperature now. Has he been feverish at all in the past few days? No, his temperature has been normal the past few times we've checked it. I always worry since he was sick last year with pneumonia, and he used to have so many ear infections, but he seems to be doing better now. And has the cough gotten better at all over the past 3 days? It has stayed the same, I'm afraid. It hasn't gotten worse. Well, he coughs more at night, actually, if that helps. I've been making sure he uses a chest rub before he goes to sleep. Do you know if anyone has taken Danny to see a doctor for a cough? My daughter was going to take him if he didn't approve, but it hasn't. But he hasn't gone. It sounds like that's what we need to do. Yes, I think we should see this. We should see. I think we should see this pediatrician today. If someone's able to pick him up from school, yes, I am able to come pick him up. My daughter's at work. Blah 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 blah. And call. Okay. Let me go back to documentation, subjective data or objective data. Make this mother states child. Mother states patient had pneumonia and ear infection last year. Patient takes Dimetapp to treat cough. Vitals, patient charts, home medication, immunizations, medical history. Pneumonia last year, treated at urgent care, bingo. Mother's type 2 diabetics, hypertension, father's a smoker, hypertension, mother, diabetes, hypertension. Okay, he's in 3rd grade. He was out for the last 2 weeks due to pneumonia. Lives with mother and father, grandmother. Okay, so he has a history of pneumonia. Yeah. P pneumonia N-E. Have you ever had pneumonia?
I think I had that last year when I was 7. My mom was really worried.
Did you take medication to treat your pneumonia?
Well, I got it last year when I was 7. I had to go to the clinic at night instead of my regular doctor. Mom was really worried, but it got better after some rest and medicine.
What medicine did they give you for your pneumonia?
The clinic gave me antibiotics, I think.
Did you finish taking all of your antibiotics? For your pneumonia medication, did you take all of the medicine?
The clinic gave me antibiotics, I think.
Bronchi lung sounds are airways.
Do you have difficulty breathing?
I breathe okay, but my nose is always kind of runny.
can't I submit this? So I need one more mild fever. Mild fever. What was his patient's chart? Vitals, temperature. So that's 37.2. Doesn't have a fever. Like a proper. Risks for infection is supported by the following. In one or two sentences, answer the following self-assessment about the diagnosis. Your answer is not automatically evaluated by students, but may be reviewed. Why would a nursing diagnosis of a cough be incorrect compared to a risk for infection? Consider the difference between nursing diagnosis and medical diagnosis. This stuff again. I'm looking up the answers for a second. Come on, come on. Right. Why would a nursing if a copy incorrect compared to a risk infection? Consider the nursing diagnosis of a cough would not directly be incorrect, but it may not provide as much explanation as a risk for a cough is a symptom that can be short from major conditions. Simply identifying cough would not provide enough information to guide nursing intervention. On the other hand, identifying a risk for infection can help guide nursing intervention by promoting the nurse to take measures to prevent spread of infection, such as using standard precaution and caring for patient monitoring patient vital signs and symptom administration medication order. Nursing diagnosis and medical diagnosis serve different purposes. Nursing diagnosis focus on the patient's response to the illness or condition, while medical diagnosis focus on identifying underlying disease or condition. Nursing diagnosis help guide nursing intervention, while medical diagnosis guide medical treatment. Both types of diagnosis are important. Why would a nursing diagnosis of cough be incorrect compared to risk for infection? By identifying a risk for infection, identify the risk of infection, then nurse can identify risk for infection. By identifying a risk for infection, by identifying a risk for infection, the nurse can use the proper interventions to prevent the spread of infection. Identifying a risk from the nurse can use proper intervention to prevent the spread of infection, such as using proper hygiene and proper hygiene, monitoring symptoms, and taking appropriate medication. A nursing diagnosis of a cough would not the symptom. A nursing diagnosis of a cough would a nursing diagnosis of a cough by simply stating the nursing diagnosis as a cough there is no intervention that can, by simply stating the nursing diagnosis of a cough, there is no intervention that can be followed up. By simply stating the nursing diagnosis of a cough, no intervention, by simply stating the cough. I'm just going to say a cough is a symptom that can be associated with many different Conditions. By the by diagnosing Danny with cough no intervention is provided. Select the goal that with short term with the patient's stay will have the greatest impact on the patient well-being. Some goals are appropriate only for a future patient. Make sure the goal always follows the SMART criteria: specific, measurable, achievable, realistic, and time-based. Ask patient family members to revise and agree with their instructions on infection prevention. Select 6 interventions that help accomplish your selected goal within expected time frame. Do not select option unrelated to this goal, even if you're there appropriate later. Instruct family and patients to wash hands for 20 seconds. Use hand sanitizer. Provide patient with cough syrup. Smoke free. Instruct patient to avoid touching fingers or nose. 34. And for a patient with cough treating antibiotics, instruct patient to cough into tissues or sleeves. So 3. So 3, 4, 5, 6. In 1 or 2 sentences, explain how you select the intervention. Here we go. The medication will help. The medication will help treat any infection that is currently taking place, and the practice of proper hygiene and avoiding secondhand smoke can help reduce the irritation of the airway, of the nasal airway. Data collection. Select one an appropriate data collection that will help you assess the achievement of your goal. Ask patients to revise. Danny, the reason why you are coughing a lot is because your body is trying to get rid of the bad germs.
Okay, I get it.
Because you go to school, a lot of your classmates, they could possibly have germs, and you might have gotten it from them.
All right.
It is very important to stay away from people that smoke.
Okie dokie, artichoke.
Whenever you cough, make sure you cough away from your hands. Cough into a Kleenex tissue and not your hands. Make sure to finish the entire antibiotic medication. Practice washing your hands before you eat. Wash your hands after you touch something that was dirty. Can you verbalize what you learned about the infection and respiratory hygiene? Did you achieve your goal for your patient and his guardian by the end of the visit? Getting each of them to agree and verbalize your instruction for avoiding infection? Did you achieve partially? Wash my hands, go to the bathroom. Danny's father said, I'll make sure we're washing our hands, meals in the restroom. Danny's drinking more food, and I'll consider smoking in the house a little less. That's kind of where I smoke though. Danny is doing his part to take care of his overall health. He has been properly educated on antibiotic medication and hand washing hygiene, as well as not touching your face or mouth without washing your hand. However, Annie's father is not fully cooperating with not it's not fully cooperating with stop is however Danny's father is not fully cooperating when it comes to fully stop when it comes to fully stopping finalizing proficient 89 objective data subjective data 94 minutes.
Mrs. Esther Park is a 78-year-old woman who comes to the emergency department complaining of persistent abdominal pain. She reports that the pain is not severe, but that her daughter was concerned and brought her in. You will have to decide whether or not the situation is an emergency and try to determine the underlying cause of Mrs. Park's discomfort. At the end of this assessment, you will complete a care plan activity to put into action what you've learned during your assessment. Again, with these focused exams, the first question should always be open-ended and about establishing that chief complaint. What brings you to the hospital today?
I have pain in my belly, and I'm having some difficulty with going to the bathroom. My daughter was concerned.
Then we will follow up on what the patient has just told us. When did the stomach pain start?
It all started, well, a week ago now.
Has the stomach pain changed at all?
Well, the type of pain never changes, nor does the location. But the pain
She's mentioning
sort of
something pretty important
fluctuates
there.
in
Identification
intensity.
of the location of your patient's discomfort when doing an abdominal exam can provide important clues about its cause and how it should be treated. So let's follow up on that one. Where is your discomfort located?
The pain and discomfort is down low in my belly.
Do you have any pain in your sides?
No. The pain is more towards the front, down low.
All right, so the reason I asked that question is that flank pain often occurs with disorders of the urinary tract, so that's an important clue. So it was important to ask that question. You'll want to continue to follow up with some additional questions to qualify Esther's pain. In an assessment like this, it's important to determine what the patient's eating habits are like as well. You want to go through and ask enough questions so that you have a pretty good idea of what her diet is like. How many meals does she eat in a typical day? Does she eat snacks? What sources of fiber does she utilize? You also want to get a good idea of what her bowel and bladder elimination is like. So again, I would start with some open-ended questions and just ask things like, have your bowel movements have been normal? When was your last bowel movement? Do you have any pain during bowel movements? Can you describe a typical bowel movement? Things like that. You want to get a very clear picture of her elimination in a scenario like this. So there's a lot for you to discuss with Mrs. Park. I'm going to go ahead and let you get started.
Hi, I'm Preceptor Diana. I'll explain the details of this assignment and your objectives, just as a preceptor would in real life. Pay close attention to this information, as it will help guide your exam. At the end of this pre-brief, you'll answer a short question about the upcoming assignment. During the simulation, you may return to these instructions at any time by scrolling to the top of your transcript. Your patient is Esther Park, a 78-year-old Korean-American woman presenting with abdominal pain in Shadow General Hospital's emergency department. Your role in this simulation is that of a healthcare provider who will conduct a focused history and physical examination of Ms. Park in order to assess her condition and transfer her care. In your interview with Ms. Park, you will ask about the history of her presenting illness and the functioning of relevant systems in order to obtain subjective data related to her abdominal pain. If you discover any disease states, ask about symptoms and the patient's experiences of them. Your questioning should cover a broad array of the symptoms' characteristics. In addition to collecting subjective data, you will perform a physical exam on Ms. Park to gather objective data about her health and physiology. Throughout the conversation, you should educate and empathize with Ms. Park when appropriate to increase her health literacy and sense of well-being. While you should communicate with patients using accessible, everyday language, it is standard practice to use professional medical terminology everywhere else, such as in documents. You will complete nursing tasks to protect the patient's safety, privacy, and health. You can document your findings, including vital signs, in the electronic health record. This record provides necessary information for healthcare professionals who will continue patient care. You will then move on to the care plan activity, in which you will synthesize your subjective and objective data to complete the nursing process. You will develop a nursing diagnosis for Ms. Park's condition, identify the In this assessment, you will become familiarized with the structure and content of an abdominal-focused exam, so that in 1 or 2 sentences, answer this question to help prepare for the upcoming exam. In a geriatric patient, what are some common considerations regarding abdominal pain? Time to begin.
My name is Nate. I'll be your student nurse for today.
Hi, I have this pain in my stomach.
I understand that can be uncomfortable for you. I'm here to help.
Well, thank you.
Tell me more about the pain.
I'd say it's cramping and a dull cramping feeling, yes.
On a scale of 1 to 10, what is your pain level?
It has its ups and downs. At the moment, I'd say it's a 2.
When did the pain first start?
The pain started as a general discomfort about 5 days ago, when I started having the difficulties going to the bathroom.
Are you experiencing diarrhea or constipation?
Well, I haven't moved my bowels lately. It's been 5 days or so.
Are you able to urinate?
I've been urinating without problems, though I have been going a little less than usual, perhaps.
Do you have any underlying conditions? Do you have any diseases?
No, just a little high blood pressure. At my age, that's very lucky.
Does your family have a history of stomach issues? Does your family have a history of stomach issues?
Well, I do remember my father having heartburn on occasion, but I can't think of anyone having anything other than that.
Describe your diet intake.
I would say my diet is fine. I don't do anything special.
Do you have any allergies?
I have an allergy to latex.
Are you taking any medication?
Just the medication for my blood pressure.
Where is the location of the pain?
The pain and discomfort is down low in my belly.
Are you feeling any dizziness?
No.
Can you tell me where you are? Are you taking any non-pharmacological relieving factors? How has the pain impacted your daily life?
I can do all of my daily activities. It just takes me longer. I'm just tired and in pain.
Are you taking any home health remedies? Are you taking non-pharmacological relieving factors? Are you taking any vitamins?
No, I don't take anything like that.
Have you had any recent falls?
I can walk just fine. I just have been resting as much as possible. Moving too much hurts.
Have you had any sexually transmitted diseases?
No, I've never had anything like that. I don't have any symptoms.
Tell me about your history of surgery.
I've had two. I had my gallbladder out and I had a C-section, both in my early 40s.
How many kids do you have?
Two wonderful grown-up children, Jennifer and Timothy.
Describe your bowel movements.
My stool, usually it's brown, not too hard, solid, not watery.
Do you have a history of constipation?
I don't usually have problems going to the bathroom, but this has been going on for about 5 days now. It's taken quite a toll.
I can understand why the constipation can be a discomfort. I can understand how the constipation can be a discomfort.
Thank you much.
I'm I'm going to take your vitals right now. I'm going to take your vitals right now.
Yes, that's fine.
Can you tell me your pain level right now again?
It has its ups and downs. At the moment, I'd say it's a 2.
Do you smoke or drink?
I never smoked a cigarette in my life. What a sad habit.
Do you drink alcohol?
Yes, but very little.
How does your blood pressure medication make you feel?
Well, I've been diagnosed with high blood pressure for many years. But my blood pressure is well controlled. I'm sure to take my AcuPearl each day, and of course I stay active. For my age, I feel very healthy, and my doctor agrees.
What do you do to remain active?
Yes, I garden, take walks. I take exercise classes at the community center, water aerobics, and I started enjoying Pilates as well.
How much fiber is in your diet?
I don't know how much fiber is in what. I don't think about it even. I have a vegetable every day or two, which I'd guess has fiber.
How often do you drink alcohol?
Perhaps a glass of white wine a week.
Have you experienced any abuse?
Goodness, I've never been abused in any sense of the word.
Do you have a family history of cardiovascular issue?
I believe my grandparents on my mother's side had some coronary artery disease. There's also a good bit of high blood pressure and high cholesterol in my family.
Do you have a history of gastrointestinal disorder?
No, I have a good stomach. I've never had this kind of trouble before. And I'm usually fairly regular.
Do you have a history of health? Do you have a history of cardiovascular issues?
I don't have heart problems, just a little high blood pressure.
Do you have a history of respiratory issues?
No, I have enjoyed healthy lungs throughout my life.
What is your current sexual activity?
I have a gentleman friend, and yes, we are intimate.
Does your medication help relieve your symptoms?
I've just been resting, but it barely helps. I did try drinking warm water slowly. I think that's a myth that works.
What is your fluid intake? Are there any pharmacological relieving factors? We will now begin the inspection process, okay? I will now begin assessing your abdominal region, okay?
All right, that's helpful to know.
The goal is to determine what's causing the pain. Understood?
I'm just not sure. I've been having trouble going to the bathroom, but I don't know what is making all this happen.
It looks symmetric to me. Symmetric appearance, no visible abnormal finding. It is beautiful. Let's check the nose. Should be moist and pink, right? Check the left side, moist and pink. Let's check the mouth. Now it's moist and pink. The oral mucosa says moist and pink. And now let's check the abdomen region. It's symmetric. Move her around. Symmetric, contour. What does contour mean? I don't know really. What is contour in abdomen? The abdominal contour means abdominal curve. The normal contour of the abdomen is typically flat or rounded. It's probably flat. Her contour is flat. Appearance, no visible abnormal findings. So we're just doing a visual inspection. Let's check the legs. Checking for edema. No edema. No edema. No edema. No edema. Do you have any breathing issues?
No, I can breathe well. My lungs feel very healthy.
Are you experiencing any chest pain?
No, I don't ever experience chest.
Do you have issues walking?
Usually I love to walk. I go for a walk every day. But since I've been sick, I've needed to rest. I miss my walks.
Now, auscultation, baby. Heart sounds. So SN1 audible. No extra sounds. We are Gucci in that department. Present in all areas, no adventitious sounds. Location, all areas clear. So now it's abdominal aorta. Abdominal aorta. No brute. Check that again. Does decrease? CVA tenderness. Swing, swing, swing. Palpate. Palpate a right upper quadrant with light pressure, no tenderness reported, no massive. Okay, no tenderness. No quadrant tender. Observation, no additional observations. So we're palpating. That was light palpation. Now we're going to do deep. Do you feel any tenderness?
Yes. The pain has been in that whole lower area.
That's the lower quadrants. Palpable. Palpate for spleen. Not palpable. kidney. Not palpable, not distension. Not palpable, not palpable. No distension. Test. Skin turgor. Skin warm and dry, no tenting. Check that. 5 interventions. Alright, instruct the patient to leave any unflushed. Instruct the patient to leave any output unflushed for examination. Assess and the patient ambulance in the bathroom. Ah, man. Provide patient one cup of sugar and eat. Provide patient 500 milliliters of fluid. So let's talk about ambulating. Assess the patient. Assess and prepare patient. Have the patient ambulate the hallway. Explain how you select an intervention work to accomplish. The goal is to alleviate the pain from constipation. Constipation can be reduced by medication and movement to provoke to induce peristalsis. Induce peristalsis. Jesus Christ, I can't spell this shit, man. Some Puritan. Oh my god. This AL. Satisfy expedient and appropriate considering that he will assess the achievement of self-law. Ask about pain rating, abdominal, nausea. So, evaluate any stool amounts. Evaluate the physical side. Perform dehydration tests. Ask about patient appetite stools. Assess change in evaluate objective. Objective. Inspect periods. Ask about pain rating. Know the pain. Boom. Park and have a conversation with Miss Park to explain the care plan. Miss Park, you have been Miss Park, we're going to discuss the care plan for your nursing diagnosis of constipation. Miss Park, because you haven't had any bowel movements in 5 days, you have been given a nursing diagnosis of constipation.
Yes, that makes sense. I'm definitely uncomfortable in that area.
Our goal is to induce a bowel movement to relieve the constipation. Our goal is to induce a bowel movement to alleviate the constipation. Our goal is to induce a bowel movement to alleviate the constipation.
All right. I'm not thrilled to have to be doing an enema.
I will need your consent to administer a mineral oil based enema, as well as informing you that we will be monitoring your walking.
Yes, you can do all of that.
I must inform you that an enema may cause side effects such as abdominal cramping, nausea, dizziness, and diarrhea.
I see. Well, I trust I'm in good hands. I'll let you know if I get any of that.
Ms. Parks drinks the fluid as per the instructions. Have the patient ambulate the length of the hallway with patient care. Ms. Park is assisted with a walk without problems. Ms. Park requests and is given ambulatory assistance. Perform a dehydration test, skin turgor, dry mucus in mouth, urine head collection, and follow up as necessary. Ms. Park exhibits no sign of dehydration and has produced 40 mils of urine output. So no sign of dehydration, produced 40 mils of urine output. Asked about patient's output, presence of stool, and sense of constipation. Ms. Park reports urinating, having a bowel movement, and failing completely relieve constipation. Great. Ask about pain relieving symptoms. Ms. Park denied experiencing any pain, 0 out of 10. Evaluate the physical signs of pain. Ms. Park did not exhibit outward signs of pain. Evaluate outputs for amounts and quality. Stool is large, formed, and brown with no signs of blood or mucus. Large, formed, and brown. Patients produce an average of 40 ml of urine And urine is clear. Did you achieve fully? Yes. Explain your choices and explain your choices. Patient has had a bowel movement. Patient reports having no pain. Patient has patient is patient has tested negative for dehydration as well as taking in food. Patient was administered enema. Patient is ambulatory. Patient ambulatory with assistance. My God, let this nightmare be over with. 89 proficient. Yay, I am free. I am free.